Dr. Bazanga, Dr. Umar, Dr. Luis Nader, Dr. Rasman, and
Dr. Welter.
Dr. Welter. Thank you guys for joining me on the Hair Transplant Network podcast. So I don't know if you guys are aware, the reason why I really wanted to come here was because I want to get a global effort on Verteporfin. I don't know if you guys have heard of Verteporfin or what it is. Dr. Barghouti is doing a clinical trial. He's in Jordan. And so far, he released his 10-month update of Verteporfin. And it seems to be something that should be looked at a lot further. At worst, I think it's going to really help with scar healing. In the controlled site, and I'll show you guys, I should have had it up here, but I'll show you guys afterwards. In the controlled site, you can see that the scars look a lot worse than it does on the test site. It looks like some of the hair is actually grown back. He took it to a pathologist. The pathologist looked at it and said there was double the amount of hair in the test site as compared to the controlled site. Our community is very interested in this. Obviously, it could potentially, multiply somebody's donor. So I don't know. What are your guys' thoughts on it? Have you heard about it? Let me know. I'll go from left to right.
Okay. Well, I have not heard about this yet, so it sounds very interesting. I need to learn a little bit more, see what it has to offer. Be great to see some of the articles and what's been written and see what's going on with it. But that's all I know.
Of course, everybody wants to see new hair that wasn't there before.
Yeah.
I doubt very much that this would do that, because I don't think we've gotten to that point in technology. The question would come up, how many sleeping hairs, telogen hairs, if you will, that may have not been taken out with the FUE come back? How much of the remnant of the FUE that was not taken out come back? I think that might be an issue. And it might be that it appears earlier because hairs like telogen hairs or remnant hairs from what's residual after the FUE would come back sooner or later anyway. It's a question of whether it comes back faster with that medication.
Yeah, and just to touch on that point, it's all right. I don't need to. I think they can probably. Just to touch on that point. All of these questions were asked. I did ask Dr. Barghouti all of these questions because a lot of people were like, yeah, it could be telogen's hair. It could be the grafts that weren't removed. He's doing another pilot study where he's going to be actually SMPing the location where he removes the grafts. But I think at worst, even if it doesn't grow back any hair, the scarring is significantly better visually. Yeah. And if you're doing FUE, the goal of any hair transplant should be growing hair on the head and also reduce scar. The better you can get a result with just looking better without it looking over harvested or depleted. As we know now with the hair mills and everything, what's going on is they're destroying the donor. So at worst, I think it's still worth exploring just for the fact that it's making the scars look better. Yeah. And just so, I don't know if you were aware, but they did a study in Stanford where they regrew the hair on mice. So they created a wound, and I guess it blocked the engrailed 1 pathway to scarring, and it regrew all of the hair and all the dermal appendages. I know we're not rats, and people have grown hair on rats before, and it doesn't work the same on humans. But it's something that the community's like they want more doctors on board, and I took it upon myself and I said, look, I'm going to be in a room full of doctors, and I'm going to give them my pitch, and we'll see what happens.
I'll just make one comment. Is that we do know that people have FUE. When you take a look at the size of the scar of the FUE at the time, let's say you use a 0.9 millimeter punch, in theory, the wound, the scar should be 0.9 millimeters. If you measure it 6 months or 8 months later, we know that it's bigger than 0.9 millimeters. So if you have a medication that will stop the stretch or allow contraction of the scar to less than 0.9 millimeters, just to put a number on it, then that medicine would have great value in the FUE patient.
There is a lot of technology though with using regenerative medicine to heal those wounds. And so I've seen a lot of in my practice, my patients with really very minimal scarring afterwards using we use them using Camel stem cell serum that's over the counter that, or I mean off the shelf that you can apply, which is very helpful. So there's a lot of regenerative properties that do that as well. Besides this, we're talking about so.
So,
No, but all I've heard of Verteporfin is what you have put on the post, and I look forward to seeing the healing, and it's going to help a lot with the donor area. Hopefully, there's going to be further studies. We always need a lot of studies to see what can be done to not promise a result, over promise. So we look forward to seeing it.
yeah, I actually first looked into this drug before this whole thing started about hair.
Yeah.
But it's in relation to keloids, because that's one of the things I'm very interested in.
Mm.
And it's one of the drugs that I was exploring
Mm.
for treating keloids. I actually have a few vials of it in my office for that purpose.
Wow.
And then I saw stuff written about it for hair. And I said, well, that would be interesting, because it's just that there's a lot of the relationship between fibroblasts and hair, and, their ability to transform between each other. There's a lot we don't know, and there's a possibility there. I mean, yesterday's talk, Dr. Ratapong was talking about how to convert fibroblasts to hair cells, and they're working on that. It looks to me like that's one track now that we're pursuing in hair regeneration. So it's possible, but it also reminds me of the extracellular matrix when they came out, and the same thing,
Yeah. Yeah.
So is there a relationship with scarring and hair? There is a relationship somewhere, we just don't know. With this drug, the field that uses it the most right now is ophthalmology.
Yeah.
Okay, so there's also the question of the side effects, the adverse effect, 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 adverse effect. To experiment with a new drug for generating hair. So we want to test this thing. We also want to do it response
my best. Uh, I attended the last course, last meeting, what I will see next, what I will learn next. But in every meeting after that, I find a new things. Just I have never heard before. I update my informations. Every meeting, I gain some more good things for my job, for my business. So this year, a lot of my experienced colleagues, they all shared their experience. I try to share my experience. We saw last surgery techniques, last implanters, we criticize a lot of things. All of them help us while we are performing the surgery. We are thinking on it, we are deciding on it, we are trying to improve the techniques, improve ourselves. So I have to say that I have to thank to Umar, because last year I learned a lot of things. Although I have experienced more than 25 years, 24 years, this year is my 25 years in hair surgery. I learned a lot of things again. So that's wonderful. Thank you, all of us. I thank all of my dear colleagues. Really, I enjoyed so much. I'm happy to be here, to be in this society. Thank you. Thank you.
Amazing.
Yeah, it's fantastic experience as usual coming to Los Angeles. And Dr. Umar put a good show with good faculties, and so we enjoy. And seeing Bill is just a cherry on the cake. Always a man of thousand ideas. I know Bill for so long, so he's always come up with something. So it actually, as Dr. Vector said yesterday, you are really an inspiration to us. When we see you keep on going, any minor aches that we may have when we're performing surgeries, and if Bill can still standing, we'll be standing.
Yeah.
Thank you very much for the
Amazing.
You are a good model for us.
No, Bill is the rock of instance. I'm very happy, very grateful to have this opportunity to make this happen. And it's all about, the fellowship, coming together, exchanging ideas, sharing ideas, mentoring others, but also learning from each other. We don't get, we're always busy in our practices. And what this does is it brings us together. That's priceless.
And this is the first one. I don't think there's any other conferences in LA that I'm aware of, right?
Yeah. Oh, well, this is the fourth meeting. It's the only LA, hair restoration meeting. We started this in 2018 or 17, I believe. It's the fourth one. And I believe it's the first meeting to feature fresh cadavers. Because, there used to be cadaver conferences, but they used to be plastic cadavers. So we were able to do that. And so that was, and we kept the tradition since then.
Awesome. Amazing.
Better and better. But yeah, thank you all for making it happen.
There was a question in here. When do you guys think the next big hair drug will come out aside from minoxidil and finasteride?
Bill, that question is for you.
Well, as you know, I'm one of the founders of a company called Amplifica, and we raised a lot of money last year. And the drug industry and multiple investors think that we've got the hopeful next drug. We're going through clinical trials starting next month, and we have at least 2 drugs, if not 3, in our pipeline, all with known ability to stimulate hair. We're targeting 2 types of patients right now. We're targeting the people with AGA that have hair loss that's documented for a period of about 5 years. And that could be any age, mostly young men, but it could be men who started hair loss later in life. And we're also targeting hair transplant patients, particularly because we all know that let's say you have a transplant on day 1. We know that most of the hair falls out by day 30, if not earlier. And then the patient paces back and forth for months, waiting for the hair to grow back. And any time between 2 and 5 months later, lo and behold, the grass grows again. And it grows in waves. And there's this period of quiet in which nothing happens. Well, we have very strong evidence from our transplant of human grafts into mice that we can induce the anagen phase of hair that has been transplanted, and that transplant shock that goes away can be reversed by just exposure to a particular drug, the same drug that we'll be using on people with recent hair loss. So that will be the first drug we're going to test, and that will be started next month.
Wow.
Just a question though, is this drug is it a combination of molecules or like serum? What form does it take?
The drugs that were in our pipeline were developed at UCI by the head of the Department of Regenerative Medicine there, Dr. Max Plikas. And he's published, he's been on in the public eye before. And he started a study in which he took hairy moles and he said, wait a minute, there's something strange about these moles. They shouldn't have full terminal normal hairs on them, and they do. And we all see people who have big moles and hairs growing out of it. So he went after the hairy mole to try to find out what was inducing the hair. And he developed a technique that's been very well respected now in the published literature to identify drugs. He isolated 25 key molecules that do it, and one by one he went through the molecules and prioritized them 1, 2, 3, 4. And this is how he got the molecules. Each of the drugs, to answer your question, are single drugs. The first drug in our line happens to be a drug that's been approved already by the FDA for other purposes. So we already have a safety factor. So this drug will not have to go through very unusual long cycle with the FDA once we get it, if it's shown to be effective on humans. The second drug in the pipeline might be not the same effect. The third drug in the pipeline may have a similar result because it's also been approved in other applications. So, so 2 of the 3 drugs have had prior approval on human use. So we're very excited about this, and I think there's a lot of optimism, certainly from the investors that have put their money in it, to see to it that this will turn out to be the next drug. I don't think this will stop hair transplants. I don't think this will be the solution for all bald people to come and get their medicine. The medicine will be, I think, eventually made into some type of cream that will be applied to the skin. Right now, it requires injections. I don't think people want regular injections at all. So the injection is the first phase for the identification of the drug, and that'll be the phase that we're going through this next year.
So one question. What is the mechanism of action? So is it going to be like a 5-alpha reductase inhibitor or DHT blocker, or is it going to be sort of like minoxidil where the mechanism of action is somewhat unknown and it just stimulates hair growth?
Well, it's going to be a direct stimulator of the anagen cycle, not like minoxidil and not like finasteride.
Okay. Has anyone here heard of Cosma RNA from South Korea? Nobody's heard of the Cosma RNA? Okay. So yeah, that was a question. Cosma RNA worth the hype. Just so you guys know, I want to just give you a brief synopsis of what Cosma RNA is. It's basically inhibiting the protein synthesis of the androgen receptors on the scalp. So it's essentially just like shutting off all of the androgen receptors on the scalp so DHT can't bind to it. And it's supposed to be released in May in the UK and Europe and probably.
My problem, we only focus on DHT theory when it comes to hair loss, but I think there's more than DHT theory when we're looking at hair loss. I think there's inflammations. There are a lot of things that we don't know. When people do microneedling and they grow hair, so it's not about DHT. So I think DHT is part of the problem, but I think there is more to the problem, and we're seeing that with regenerative medicine and all that. So I think we should not just focus on DHT. I think people are so hooked up to DHT because if it was just DHT, you just give people dutasteride, that will block all 5-alpha. Everybody will grow hair, and it's not the case.
No, we know when we began DHT, that slows the hair loss curve out. It pushes it out for a while, but then the hair loss curve resumes, and you continue to lose hair. And we know that because there are lots of factors that cause hair loss besides DHT, the entire Wnt pathway and everything else. There's just all these other and multifactorial beyond that. So It's not, yeah, it's absolutely not just DHT. We also know DHT is more of an early, like the sooner you begin DHT, the better response you're going to have in most patients as well, because it's an early insider. So there are, I think that finding optive mechanisms that you can block or work on later in the pathway are actually going to be the most effective drug treatments for hair loss.
I think what Dr. Basanja said just now is very important. We know that the numbers of hair cycles may be genetically programmed. So let's say, just for simple mathematics, that the average hair cycle, that every hair has a 3-year cycle.
Yeah.
Just for the purposes of this discussion. Okay, so if you had your hair loss starting at the age of 18, and it was a 3-year cycle, then you have 6 cycles, and at the end of the 6 cycles, the hair's gone, and it just dies because it's got programmed death to it. Okay? The question, of course, comes up is as you prolong these cycles and you delay what I will call the inevitable, all right? The inevitable sooner or later happens. So as Dr. Basanja basically pointed out, it's not quite simple. We like to put things in little baskets and say, all right, if we just solve the DHT problem and the DHT receptor problem, that it's going to solve the hair problem. And that's not the case because hair is complex. We don't even know what genes are responsible for hair loss. And we've known so much about genetics recently, all the breakthroughs, with all the billions of dollars spent on hair. Why don't we have an answer as to what genes cause hair loss? And we do not know that. So I think I remain skeptical. And even on the drugs I talked about a moment ago, I don't have any idea that if we get a regrowth, whether that will be perpetually able to do it every 3-year cycle. So we have 3-year cycles. Whether every 3 years we can administer the drug and then get an extra cycle out of the life of the drug and overcome this pre-programmed apoptosis, the genetics, instant cell suicide. We don't know that happens. So we just keep working and keep doing our job, and the researchers keep doing their job, and maybe we'll have some miracle happen. And at this meeting, one of the great things that I heard about was some of the progress on cloning, which I have to say was a revelation to me, because I've been in this business 33 years now, and I have not seen any really great cloning numbers or patterns of research that have developed like I saw at this meeting. So I was thrilled to see that.
Yeah, I'm super excited about hair cloning. I'm not sure if it's, there was Intercytex back in like the early 2000s, and now Dr. Farjo is doing the hair clone. There's Stemson Therapeutics, which is like, 50 miles away from here. But I don't know. But you guys bring up a good point. I know that we're running short on time. So before we go, I want you guys, because like I said, the community is how they really want the Verteporfin trials. So what's your guys' information? Don't take it from me. Take it from the patients. We'll go around and where can people reach out to you if they have a question or if they say, hey, give the Verteporfin a try.
Well, I'm in Boston. My name's Ryan Welter. I'm at Ryan at NE, like New England, NEhair.com. So NEhair.com is where you can find me. You're welcome to email anytime with any questions you have.
Yeah, my name is William Ransford. Any patients that have specific questions to me or want some specific advice relevant to these types of drugs, they can write to me at williamransford33@gmail.com. Perfect.
I'm Dr. Lee Snyder. I'm in Mexico. I'm lousy at answering email. And I'll eventually get to every single email.
I know why you responded to me.
I'll message him, guys. I'll message him.
Yeah, I'm Sanusi Umar. I'm a doctor, DRUMAR, Dr. Umar at DRU.com. Like I said, I have actually 2 vials of the product. It's quite expensive, by the way. That's, I remember it was very difficult to find.
Yeah, it's through Visidyne, right?
Yeah.
Yeah,
I
Visidyne.
tried to get it. When it arrived, it's just like a few drops of it, And it's
So-
like 3,000 something dollars. It's very expensive.
We'll talk after this. There's a whole like I said, there's a whole network here that's doing a crowdsourcing thing that would help in funding it because there's a high demand. But Dr. Bazanga,
I'm Dr. Bisanga, and you can contact me info@bhrclinic.com. I'm open to try anything, but what I know also is people get hooked up on this is that when ACell came out, I have doctor who not closing the wound of strip, just putting the powder
Yeah.
ACell, saying that it will regenerate, and then I end up with patients with almost 3-4 centimeter scar with all the powder of ACell put in it and nothing. And
That's true.
so I'm I'm down to earth. So I've been around. I've seen trend coming and going. People saying this. We had back then. You remember Dr. Bo, who was saying the regeneration, and people
Splitting
were
hairs.
flying to Amsterdam to think that they get the new thing. So I think people need to also be on the ground, and it's one thing to grow hair in the mice. It's another thing to grow hair on a scalp for human. It takes 20 days on a mice. It takes 1 year, even more, when you do a hair transplant. So, yes, it will be open, but as I say, it's not just about DHT. There are more to it that we don't know, and we just need to keep on working, and hopefully, light will come one day.
So that's the thing about these mice, they will grow hair. Exactly, just touch the mice and the hair will grow. So that's
Yeah. I mean that to be fair, there is like that one trial that Dr. Barkuthi is doing, and it does look promising. Now, I'm not a researcher, but I'm more than happy to give you guys his information. He told me, yeah, give them my information. I'll connect them. I'll send them all of the trial information and the pathologist information and everything. So don't take it from I'm just the messenger, and I think there's a
Melvin, you can take 10 pathologists and you give them sample hair, and they will come each one with a different hair. So it's very difficult to count hair.
yeah.
And and I don't think that the pathologists are the best one counting hair, but that's my opinion.
Chris he's always very pragmatic, very and it's I think that, like I said, at worst maybe it reduces the size of the punches and it helps with scarring. People are looking at it with the with FUT as well. I don't know who performs FUT here. I don't think most of you perform. I don't know, do you perform FUT regularly?
I do FUT when it's
When it's
required in certain patients, scar revision, otherwise, but 99% of my practice
is FUA.
Are we looking at this drug only in the context of hair transplant?
Yeah, so we're looking at the drug in the context of hair transplant, not for a lot of people are asking, can it be used sort of like like a what do you call the FAK inhibitors that are used for alopecia areata? And in my opinion, and this is just my opinion, I think that it's best used with a hair transplant because if you can reduce the size of the scar or anything like that, that's what's going to give you the most bang for your buck, right? We know hair transplants work, 1,000%. We know they work, so that's a proven method. This is not necessarily proven, and it's expensive, so it's best to use with something that's proven. And I know personally, there's like on the forum, just dozens of guys saying, "I will be a volunteer. Sign me up." They'll be a volunteer. So I don't know. I'm just throwing it out there. Hopefully we can get more people on board.
I'm just gonna add to the cost.
JAK, yes.
I think that I can speak to everyone in the room that it is in our best interest to have the best for our patients. And like Dr. Umar said, FUE, we do a lot of incisions in the skin, and the skin is our barrier or external barrier for mixed hair. So putting something topical on an FUE area can have different results. I mean, the level of absorption could be minimal. It could be immense. So for someone to say, "Hey, put this on my skin. Let's see what it does," it
So
makes this thing.
yeah, so right now it's an injection. So he's injecting each site, so he knows exactly, because that was what some people were saying. Like, are you going to use it just as like a band, like just he's at each site, each extraction site. So right now it's just literally just like a small square. It's just a small square of the controlled site where he's extracting maybe 30 grafts, and just to see like it doesn't work. But so far, I'll show you guys the pictures. I think it looks pretty impressive. Could it be just the scarring is better? It's very possible. It could be it could be a lot. It could be a lot of things. There-
I can take pictures of mesenchymal stem cell serum, FUE, that are very good, with very minimal scarring. And that serum is, you can get that serum for a couple $100. So it might be a different avenue to look at.
yeah, there's always
So if you do 3,000 kids and you start going again and injecting every single.
yeah, I don't know how it would work on a large case. The thought behind, if it's regrowing it, maybe you do smaller sessions, and just kind of, because if it's regrowing the hair, then you do a smaller session, the hair regrows, and then you can keep going.
So you're taking the hair out and then you put this and
You're
put the
injecting
hair
it.
in the.
Yeah, because what it basically, if the hair grows back, yeah, by blocking that fibroblast.
If he's noticing hair there, is it just hair that is regenerating that was there before, or is it some scar that is turning to hair?
Um,
Process.
Based on looks alone, it looks like there's hair that's regenerated. Again, I think this is just the problem was that it's kind of hard to pinpoint exactly where the extractions were done. So he's going to be doing his next trial where he will be SMPing the extraction site. So he will know exactly, okay, this is where an extraction was done. If a hair regrows out of there, then for sure.
How do you know if you miss? Because there is a transaction
Yeah.
always. So
I think the only way.
if you extract the follicle, if you have a 3 hair and then you extract 3, you leave 1, and that one regrow, you're gonna count it as a regrow hair from your drug, or is just something
So-
that normally will regrow anyway?
So one thing that's absolutely clear that we already know, and then you were talking about the advances in cloning. I mean, this past year actually has had a lot of advances in cloning. The things that we already know is that you need ectoderm cells, you need mesoderm cells, you need them to interact at the cellular level. So if there is a regeneration of hair from a excised follicular unit, then the only way that that's happening is if there's some cells that are remaining in that remaining nidus there. So yeah, in the wound. So if there's some there's some precipitation of interaction between those, both the cell lines have to be there. So there has to be enough of both cell lines. So it is very easy when you're using very submillimeter punches. You get down to 0.7, 0.75, 0.8. That you will transect a part of the follicle, and there'll be some cells left, and you'll have you'll have an actually something that's able to transplant, and then it's something that might remain. So that's obviously theoretically possible when you get down to that level. But in my mind, and from what we've seen in all the literature, the only way that would be possible is that there's the stem cell nidus from the bulb is there, and then some sort of ectodermal interaction is there. So.
I'll add just one additional point. FUE itself is not as good as the original strip surgery, because what happens with FUE is you disrupt the capsule of the follicular unit, And many times with FUE, the distal half of the capsule is left behind in the wound. And with that, the fat that surrounded the bulbs are left behind with the capsule. The FUE most of the time strips out the hair follicle itself, the actual hair shaft itself, excuse me, I didn't mean the follicle, but the shaft itself, leaving them bare and denuded of the distal capsule and the fat around the capsule. So there's some goodness left behind for whatever it's worth. I don't know that anybody knows what to do with it or what value it has. Maybe this new drug has some value with regard to those components, but I don't believe that any of the research I'm familiar with, and Ryan maybe be able to better talk about that, has shown the value of a stripped capsule in terms of being able to regenerate a hair follicle from a stripped capsule with some fat. I don't think that's been studied, but I don't know. I try to follow much of the literature. Anybody else want to comment on that?
Why not just isolate an area and inject it and see what happens without the FUE at all? I mean, is it inducing anagen hair? Is it regenerating new hair where it didn't exist? Because that's something to look at too, you know?
Yeah.
Or at least as control.
I think there's a demand, there's a patient demand. It would just make sense to at least see. You know, I agree with you, Dr. Bazanga. I know Dr. Bazanga is very pragmatic and logical and rational about it. And yeah, I was when I first, because people started bringing them, talking about it on the forum and saying, hey, look, there's this Stanford research where they created a wound on mice where normally, you know, a scar happens, the hair is not growing back, but they injected that wound with verteporfin, and not only did it not, the scar not, it didn't scar, but the hair grew back, all of its normal appendages. And then Dr. Barghouti did this trial. So far, it's looking promising, at least in terms of scarring. And so I just think that since everyone here is in the hair transplant community, and I think that it should be said, we're not saying that this is going to be a hair loss cure. It should be something to be combined with surgery.
No, I understand that, but I'm going to tell you, if some drug or something that will heal the scar and make the scar disappear, I'm thinking that the U.S. Army will be the first one to buy it for all the wounded soldiers and all that. So we're not going to even talk about hair, because that will be billion and billion that the Army is going to be buying. So I am very, very skeptical when it comes to these claims, because again, a mice is not a human, and we all know that they've been cloning hair on mice for God knows
20 plus years.
how long, and we haven't seen any hair grow from the cloning and all that. So I think it's good that there is an interest on a forum for hair loss, but I think if you have such a drug, there will be other fields that will benefit more before hair transplant.
Without a doubt. That's why I'm honestly
imagine
surprised.
China, imagine Russia, imagine all this. Everybody will follow up and get this drug before even it become available for hair transplant doctors. So it's good to have that, but I think it's we have to stay pragmatic as well.
Yeah. Well, thank you guys so much. That was my pitch. Everybody here, hopefully you guys got their information. Send them emails. There's only so much we can do, but I think if there's a will, there's a way. If there's a demand, doctors will listen. And thank you guys for allowing me to, share this information with you. Before we end, again, I just want to go around and just shout out your email and your website.
Okay, here we go. Yeah, Dr. Ryan Welter, Ryan at anyhair.com, and the website is anyhair.com.
William Rassman 33 at Gmail. 2 S's in the Rassman.
Email at nadermedical.com.
Sanusi Umar, DRUMAR at DRU.com. Website is DRU.com.
Info at bhrclinic.com, Dr. Bisanga.
It's the same email because we work in the same place.
Costas was a little quiet today.
www.özlembiçer.com, info@özlembiçer.com, my mail. I'm hopeful. I'm sure that we are going to find, one of my colleagues will find in the future, maybe the GAN, maybe the vaccine, maybe the lotion, and this society will be very happy. I'm sure that the patients will be happy. We work so much, but we try to treat it. It's difficult to find the exact reason and to block it. It's more difficult than to treat it. So it needs time. We have to be careful. We are doctors. We cannot say that do it, use it. It's easy. It's easy to talk. We have to protect the patients. We have to be more conservative, but I'm hopeful. Thank you.
All right. Well, thank you guys. We'll wrap it up.
Thank you for having us.